If you liked this video, leave a like, comment below. Hello friends. Welcome back to our channel. In today's video, we will be discussing another important topic that is diabetes. This video is part 2 of the series. In part 1, we have already discussed about type 1 and type 2 diabetes. If you haven't seen that video, please check it out. You can find the link in the description box. Now moving on to the second part of the series, gestational diabetes. It affects pregnant women who are either overweight or obese, or those with a family history of diabetes. Gestational diabetes typically develops during the second half of pregnancy. This condition makes it harder for your body to regulate blood sugar levels because of changes in hormones. During pregnancy, your baby also gets affected by this. High blood sugar levels during pregnancy can cause problems for both the mother and the baby. However, most of these problems can be prevented with proper management of blood sugar levels. In this video, we will discuss causes, symptoms, risk factors, diagnosis, and treatment of gestational diabetes. Let's get started. 1. Cause. As I mentioned earlier, during pregnancy, there is a hormonal change that happens in the body. These hormones produced by the placenta can make your body's cells less sensitive to insulin. As a result, your body may not be able to use insulin effectively, and hence your blood sugar levels rise. 2. Symptoms. Many women don't experience any symptoms at all. Some common symptoms are increased fatigue, increased thirst, frequent urination, blurred vision, headache, nausea, vomiting, especially in the morning, and tingling in hands or feet. 3. Risk factors. Now let's discuss various risk factors associated with gestational diabetes. Being overweight or obese increases the risk of developing gestational diabetes. Having a family history of diabetes, especially type 2 diabetes or previous history of gestational diabetes, also increases the risk. Certain ethnic groups such as African Americans, Hispanic Americans, American Indians, and Asian Americans are at high risk. Women who are not physically active on a regular basis are also at risk. If you had polycystic ovarian syndrome while trying to conceive, then there is a higher chance of developing gestational diabetes. 4. Diagnosis. How do we diagnose gestational diabetes? Gestational diabetes is usually diagnosed with a glucose challenge test, which includes drinking a sugary liquid followed by a blood test. The first test usually involves drinking a specific amount of liquid containing glucose. After this, your blood will be tested after 1 hour. If the results show high blood sugar, then further testing will be done. You will be asked to fast overnight, and your blood sugar will be checked 2 times during this period. If the result shows that your fasting blood sugar is above certain level, then you will be diagnosed with gestational diabetes. 5. Prevention. There are a few things you can do to lower the risk of developing gestational diabetes. 1 is maintain a healthy weight before and during pregnancy. Gaining too much weight during pregnancy also increases the risk of gestational diabetes. Try to be physically active. Aim for at least 150 minutes of moderate exercise every week. Eat a healthy diet. Avoid processed food and sugary drinks. Increase the intake of fruits and vegetables. Now that we have covered causes, symptoms, risk factors, and diagnosis, let's move on to the treatment of gestational diabetes. 1. Healthy diet. A balanced diet is very important if you have been diagnosed with gestational diabetes. Eating healthy will help to control your blood sugar levels and will protect your baby. Your daily diet should include complex carbohydrates, proteins, and healthy fats. Avoid sugary drinks, processed food, saturated and trans fats. Always try to eat fresh and unprocessed food. Avoid white bread, pastries, cakes, cookies, etc. Instead, eat whole grain bread, brown rice, quinoa, oats, etc. Choose complex carbohydrates over simple carbohydrates. These carbs will keep you full for a longer period and will also help to control your blood sugar levels. Include plenty of fruits and vegetables in your daily diet. They are rich in nutrients and antioxidants. Fruits like apples, berries, bananas, and vegetables like broccoli, spinach, and carrots are highly recommended. Also, they help in weight loss. Consume lean protein like beans, lentils, tofu, nuts, and seeds. These are good sources of protein without extra fat. If you are a non-vegetarian, then opt for chicken breast, fish, or turkey. Eggs are also a good source of protein. Select healthy fats instead of saturated and trans fats. Olive oil, canola oil, and sunflower oil are good sources of unsaturated fats. Also, avocados and nuts contain healthy fats. Check your blood sugar levels before and after consuming meals. This will help you understand how different foods affect your blood sugar levels. Maintaining a food diary can be very helpful. Write down everything that you consume and check your blood sugar levels regularly. Number 2, physical activity. Engaging yourself in physical activity is very important if you have been diagnosed with gestational diabetes. Strive for at least 150 minutes of moderate exercise every week. The best exercises for you are brisk walking, swimming, cycling, or any other activities that make you sweat a little bit. Being physically active helps to use insulin more efficiently. This lowers your blood sugar levels and reduces the risk of complications. Discuss with your doctor about the kind of exercises that are safe for you during pregnancy. Don't forget to take rest when you feel tired. Stay hydrated. Drink plenty of water before, during, and after exercising. Warm up before starting the activity and cool down afterwards. Start slowly and gradually increase the pace and intensity. Number 3, blood sugar monitoring. Checking your blood sugar levels regularly is very important. This will help you to make necessary adjustments in your diet or physical activity. Self-monitoring helps you to know how well your body is responding to food and exercises. This also helps to prevent hypoglycemia. Frequent hypoglycemia can harm your baby. Number 4, medication. In some cases, medication is required to manage gestational diabetes. These medicines help to bring down high blood sugar levels. Insulin is the most commonly used medicine. Your doctor will decide the amount of insulin and the frequency of injection. Other than insulin, there are some pills that can be prescribed by your doctor. These pills stimulate the release of insulin from the pancreas or make your body's cells more sensitive to insulin. Number 5, delivery. By the time you are ready to deliver, your baby will be fully developed and your organs will start making insulin again. Your blood sugar levels will fall, but this might take some time. For some women, their blood sugar levels may remain high for several weeks after delivery. In rare cases, some women may develop type 2 diabetes within a few months after giving birth. Complications of gestational diabetes. Now let's discuss some potential complications associated with gestational diabetes. High blood sugar levels during pregnancy can cause problems for both the mother and the baby. Few of them are preeclampsia, which is a serious condition characterized by high blood pressure and signs of damage to the liver or kidneys. Preterm labor, which means labor that begins before 37 weeks of pregnancy. Babies born early may have breathing problems and other issues. Premature birth increases the risk of learning disabilities and behavioral problems. Large baby. Babies of mothers with uncontrolled diabetes have an increased risk of being overweight at birth. Shoulder dystocia, which is a difficult delivery for the baby. Excessive fat in baby's body can cause shoulder dystocia. This happens when the baby's shoulder gets stuck behind the mother's pubic bone during delivery. Neonatal hypoglycemia, low blood sugar in newborns. Babies with high levels of insulin are at risk of developing low blood sugar after birth. Hypoglycemia can cause breathing problems, seizures, and even brain damage. Childhood obesity. Children born to diabetic mothers are at high risk of becoming overweight or obese. This may be due to genetic factors or increased fat storage. Stillbirth, which is the delivery of a baby that has not shown any signs of life. Stillbirth can occur when the baby does not get enough oxygen through the umbilical cord. If you think this video is helpful, please hit the like button and share with your family and friends. Gestational diabetes can be scary, but you are not alone. Lots of women successfully manage gestational diabetes and have healthy babies. Eat a balanced diet, stay active, and monitor your blood sugar levels. Follow up regularly with your doctor. Take care. Bye-bye.